Hello, my name is Jennifer Chan, and I'm going to be sharing with you about occupational therapy, improving participation in daily activities for persons living with epidermolysis bullosa. I'd like to start with defining what occupational therapy is, or what an occupational therapist does. OT helps people who have limitations due to disease, injury, or disability to improve their participation in daily activities. And this is accomplished by changing how an activity is done, modifying the environment, or improving a person's abilities to make participation possible. So how can an OT help a person with epidermolysis bullosa? They can assess daily activities such as personal care, participation in school and work, leisure skills, and social activities. They can advise and provide suitable modifications and/or equipment to improve abilities to perform these tasks, and they can instruct in methods or exercises to improve a person's abilities to perform tasks. Ideally, an occupational therapist works as part of a multidisciplinary team. This includes doctors, dietitians, psychologists, physiotherapists, speech and language therapists, social workers, and most importantly, persons with EB and their caregivers. So what is the purpose of a clinical practice guideline? You may have heard about clinical practice guidelines, or CPGs. Well, these are documents that help therapists throughout the world working with persons with EB to know the best things to do based on available research rated by the CPG panel to be relevant and of acceptable quality. The clinical guideline also helps persons with EB to know about resources that may be available to them. So how was the occupational therapy CPG created? Well, first, a panel was assembled by Deborah International with representation from various healthcare workers, a person with EB, and a caregiver of a child with EB. A survey was sent out to persons with EB, caregivers, and experienced healthcare workers internationally to help determine the most important issues that we should study. From that survey, 5 issues or outcomes were identified as the most important subjects to look into. And this included independence in activities of daily living, independence in instrumental activities of daily living, maximization of hand function, fine motor development and retention, and oral feeding skills. First, I'll highlight activities of daily living. Well, activities of daily living are basic activities performed by people on a daily basis, such as feeding, dressing, bathing, grooming, and personal hygiene. Based on our findings, we recommend that occupational therapists help to advise on how people can perform these tasks. For instance, for babies and toddlers, some examples are baby socks with padded soles, baby-sized knee pads for when babies are crawling, use of padded elbow sleeves. For children and adults, OTs can help advise on clothing choices that ease self-dressing. Seamless clothing, socks, and underwear help to limit rubbing on the skin. Breathable fabrics help to keep people cooler. And here's an example of double-layer socks that help to glide smoothly over the feet and absorb friction. There are also examples of tools to help to improve independence, such as these. Instrumental ADLs, or IADLs, are activities that support daily life within the home and community that are often more complex than the basic ADLs that I just described. These include child rearing, driving, going to school, working, cooking, and performing leisure activities. As part of a clinical guideline, there are additional files, and one of them is a list of camps and recreational activities specific to persons with EB throughout the world. There's also examples of equipment to allow greater independent living. For maximization of hand function, Occupational therapists should provide periodic hand assessments for those who are most vulnerable to hand involvement, recommend on hand exercises, and advise on hand wrapping and hand splints. Here's some examples of hand exercises. There are stretches for the wrists, interdigital web space stretching, and also stretches for the thumb so that it can come out of the palm. Here's some examples of hand wrapping and splints to help maximize hand function. The wrapping can be either closed fingertip or open fingertip. There are soft splints, and also there's use of silicone putty that is soft and can help preserve web spaces. For fine motor development and retention, we recommend that occupational therapists assess the development of fine motor skills in babies and children with EB. OTs can help to strategize on optimizing movement and strength of the hands to allow functional pinch and grasp, and also advise on adaptations and equipment to help people to continue to be able to perform tasks that require fine motor skills. Here are some examples of tools. There's an Oliver glove that was created especially for persons with EB that have mitten hand deformity. School-age children can use loop scissors, and adults too can use loop scissors that require less hand strength. And for babies, soft and easy to hold rattles prevent skin damage. For oral feeding skills, ideally the OT would work with a multidisciplinary team to coordinate the best feeding plan to help persons with EB that are experiencing difficulties with eating orally. OTs can help people learn to chew and manage food that becomes and help them become more accepting of different food textures and flavors, and recommend on foods that are easier to manage. Recommendations also for special tools to improve ease of independent eating. And in some countries, OTs will help with the assessment and management of swallowing issues. Here are some examples of feeding equipment. There's a raised lip plate with a non-slide bottom that helps to scoop food onto a utensil, special bottles that have controlled flow, and soft adaptive foam tubing to help holding of utensils without causing skin damage. The occupational therapy for epidermolysis bullosa clinical practice guideline was published by the Orphanet Journal of Rare Diseases, and here's the direct link. With the help of Deborah International, there are also patient versions. There's a patient version for adults with epidermolysis bullosa, and it's available for download on the Deborah International website. There's also a patient version for caregivers of children with EB, also available for download on Deborah International website. These patient versions also have quotes from patients and have a lot of illustrations. I want to especially thank those who helped in the creation of this clinical guideline, Deborah International for guidance and advising throughout our process, Deborah of America for funding our project, Lucille Packard Children's Hospital, Stanford, where I work, for many resources in completing this project, and the members of the guideline panel, Amy Weissman, Alex King, Susan Maxomsky, Carissa Shotwell, Clara Bailey, Helen Weaver, Rebecca Bowden, Estrella Guerrero, Matija Zamachek, and Fong Ku. Thank you all. And now we also allow a time for questions, and we hope to field these in and be able to answer any questions that came up from this presentation. Thank you.